Hi, Stella.
How's it going, Sasha?
It's going well. We had a return guest on today. We actually promised our listeners that she'd be back in a few weeks, but it was only 11 months, but that's okay.
It was only 11 months, but actually it turns out it was really good to get that time because Maggie Goldsmith's daughter has desisted, and Maggie gives us a good analysis of a kind of a longer perspective, the wider lens, if you will, on desistance and watching it, and she kind of had some really profound things to say about the parent's journey of the child when they're desisting, and also about how the kid themselves experience desistance.
Yeah, I mean, we talked about, basically Maggie thinks that all of this gender stuff is a communication to the parents, asking them to do something differently. It's sometimes individuation and differentiation. Well, she says all the time. But it's really a call to parents to kind of look at their own dynamics and make a change. And it reminded me a lot of when we talked to Stoic Mom, for example, that her daughter was kind of calling her to behave in a new way. And Maggie also brought in kind of the psychoanalytic perspective and object relations theory. So for any therapist listening, this might be really interesting. And how that helps us understand, like, what is the child really asking from the parent?
Yeah, because Maggie's a psychologist, so she brings a lot, and she's very well read, so she brings a lot to the table, because it's not only the parent's perspective, but it's also the psychologist's perspective, having worked with kids who've desisted and having a kid who has desisted. So there's an awful lot in Maggie. As well as that, as just a parent, not a parent of a gender kid, but as a parent, I did feel seen in the middle of it. I was biting my lip a few times during this interview going, God, we really do want our kids not to have any troubles. And we feel so disturbed when they do, when actually it's the human condition. Our kids are going to have troubles. And so it was very good for me as a parent listening to Maggie. It was good for me.
Yeah. And one of the things that we wanted to do is encourage listeners, if you're here, whether you're on YouTube or you're listening through the podcast, please take a look at the conversations happening on our YouTube channel. It's kind of amazing how many engaging, fascinating discussions are happening there. So please like and subscribe. Go check out our YouTube, even if you prefer usually to listen while you're walking or doing dishes or whatever, just to see the conversations happening there. And I guess before we dive in, I'll just kind of read a little bit more about Dr. Maggie Goldsmith.
And I do want to remind our listeners as well to, if you want to support our work, do sign up to our Patreon, because we put in bonus content there, and we try to do our best to get the word out there, and we'd appreciate any support that people want to give.
Yeah, we asked Maggie about how she actually addresses gender in real life.
Yeah.
And it was really interesting to hear her answers. She had a lot of practical wisdom around this because she's a clinician. She's in a very kind of affirmative landscape. So if you're interested in that, please check out our listener exclusives in Patreon. And a bit more about Dr. Goldsmith. She's the author of the Pitt essay, "To My Daughter's Therapist, You Were Wrong," which was the first essay from the Pitt Substack to go viral, and it put Pitt on the map. It can be found in a recently published book, which I have right here, that includes 75 essays by parents who have gender-questioning children. And since our first episode together, which was episode 85, she's been actually quite busy with a caseload full of kids and families impacted by gender dysphoria. So Dr. Maggie's approach to this work is grounded, as we said, in object relations theory and supported by an understanding of human development through the life course. And this places the family and the parent-child relationship in a position of primary importance in her work as they manage to repair the inevitable ruptures of adolescence. So with that, we hope you enjoy our second conversation with Dr. Maggie Goldsmith.
Hi, I'm Stella O'Malley, a psychotherapist in Ireland.
And I'm Sasha Ayad, an adolescent therapist in the United States.
Through in-depth interviews, personal stories, and psychological exploration, we probe the gender landscape within contemporary culture.
And we consider the implications of prioritizing personal identity over other aspects of the self.
This is the thinking person's take on gender.
Join us as we look at gender from a wider lens. Welcome back, Maggie. We're glad to have you again, 11
Hey,
months later.
hey, thanks for inviting me back. Looking forward to this.
Yeah, us
Yeah.
too. You
It's
know,
great. The last time it was a brilliant conversation, and I think an awful lot of parents especially were really taken with your story. It was
yeah,
really moving.
Yeah,
yeah.
yeah,
And when we were kind of ending our conversation last time, you made this really important point, which is when kids start to question their gender, they often do so with a big bang. There's a big announcement. There's this very in your face kind of behavior. But then if they're desisting, you don't have a formal announcement. There's not a lot of clarity. It just kind of shifts and flexibility comes in, but parents are often very unsure of what this means. So you were kind of at the beginning of what seemed like your daughter's desistance last time we talked. So can you tell us a little bit about what's happened since with her?
So, since coming back from being abroad for 4 months together, she she decided to go to university for a semester. She went for a semester and found that it wasn't the right place for her because it was very much a party school and she's not a party kid. But she got through for a semester and she did brilliantly academically, and the professors all loved her because she's smart and she's very creative. Um, but she decided that she's going to withdraw after a semester and come back home, and she's going to reapply to schools. Well, one thing that happened, and I'm sure the two of you know this, is that very often when there's gender dysphoria or there's a gender issue, there's other things underneath it. And
Yeah.
very often with girls, what's underneath it is potentially an eating disorder. So when the issue dissipated, immediately what came right up was the eating disorder.
Whoa.
And this is what happened during that first semester of university. So for her health, she needed to come back home and really deal with the the eating disorder. She is now fully weight restored. I think eating disorders go into remission. I don't think that eating disorders are ever like cured,
Hmm.
you know. So I would say that her eating disorder is very much in remission right now. She's gone back to university, a different college. She's just starting this week. And, she has a lovely boyfriend who
Hey.
they just really love each other and they're so sweet. And he's so supportive and she's so loving. And, I feel like that's, you know, I mean, it feels like happily ever after in a way. It's like, it sounds like like a trope. And then she got this
Yeah.
boyfriend and everything was fine. And I don't think that's
The
what I'm,
feminists will be throwing tomatoes at their
yeah,
computer right
but the thing is, it's like, it
Maybe
feels
they're
like
right.
she's integrated so many different parts of herself. And the thing is, it's like, she does not want to talk about the gender stuff at all. Like I'll
Yeah.
bring up ever so slightly, and she's like, I don't care. I don't care. The most I can get from her is, it was a very dark time in my life.
Wow.
And can I ask you, do you think, is she, because it kind of gives a bit of an insight into the early desister, because she's a year in.
Yeah.
Do you think she is ashamed of it, or is she embarrassed, or is
I
it,
think that's definitely
yeah,
part of it. I think part of it is that she's embarrassed. Part of it is also that I think she recognized like how hurtful it was and how hurtful she was at the time. Because during
yeah,
the whole gender thing, I mean, this is, Stella, I think you've talked about like these kids, like these girls are they're very pleasant, they're very agreeable all their
yeah,
lives, and they're very attached to their mom or their primary
yeah, they're
caregiver.
good
And
girls.
this is like really the first time that she really let me have it,
Mhm.
that she really said, no, it's not going to be, I'm not going to be who you want me to be. I don't want to be yours anymore. Um,
That's what
you
she
know,
said.
um, That's what she said. Remember, we said that at at
Yeah.
the end
Yeah.
of the last. That
Yeah.
was her statement. I don't want to be yours anymore. And it was a profound thing. This was, she needed to separate and she didn't know how. And I think this is the case with every single kid who is going through this, is they need to separate. Something has been thwarted about the developmental course. And then this is so much in the culture, this gender thing is so much in the culture, and it's so prominent, and it's so much part of the language that it's available, and that's where they go. This is
Wow.
how they choose to it's almost like it aborts the separation, right? Like you can't really separate, because it makes your parents so panicked that they're holding on to you even harder, so
Yeah.
yeah, so I think, yeah.
I mean, I often say that this seems like a conflict around the desire to separate because
Yeah.
at one level, like if a parent goes along with it, then all of a sudden your child is almost in an infantile state where they're going to become, patient and you're going to have to take care of them after surgery. And they're very much in that kind of being nurtured place. And yet they're also declaring somehow, I'm not who you thought I was. I'm this person who can make adult decisions. Like it's an interesting way that the subconscious might be saying, I'm actually scared to become an adult. I need to be babied. I need to be cared for, and I need you to kind of go on this journey with me.
It's also a reflective of the kind of classic codependent relationship where it's a push and a pull, where I'm dependent on you and I'm furious I'm dependent on you, and I become contemptuous of you to show my powerless need to try and be independent, and I'm being thwarted and I'm not able to do it, and they can it's really well
It's like
I
a
know.
toddlerhood, isn't it?
Yeah,
It's like really a
it's
second toddlerhood where, I'm trying to, I don't know how to do this, but I'm pissed that I can't, and that somehow I feel like
furious.
you're holding me back.
Yeah,
You're
furious.
holding me back. And
I
if you look at the context of the, this cohort of kids, the context in which they're trying to separate, there's a lot of things that are different. People talk about, like, the smartphone, for example, is a big thing people talk about, and then the pandemic. I mean, both of those things have done their part, I think, to thwart the natural separation process,
oh
because
God, yeah.
rather than sort of going out into the world and expanding and sort of making new friends and uh, seeing the world, I mean, what happened? It's like their lives have constricted into this screen, right? But at the same time, what's behind that screen is like so much that it sort of supplants the human connections in a way. It's the community. Before, you had the extended family and your child ran across the street, or went to auntie's house, but now we don't have that anymore. We have YouTube, and we have all of these things that sort of
And
take the place
and the
of.
LGBT community. I mean, it's
Right.
interesting that that's called a community. There's actually no connection, no deep knowing, no actual helping one another in, like, real
Yeah.
times of need. Like it's an interesting use of the term
Right.
You're
community.
so right, because we grew up with the word community. It was a parochial, small,
Yes.
making cups of tea and baking buns for each other. Community was the person across the road. So far from an online, virtual kind of scene. It couldn't be a more unusual
And
use of the word community.
those communities, like, let's say, like, everything has its benefits and its, sort of detractions about it. When you have a community that's like close knit and you're making tea and baking buns for each other, you also have obligations toward those people. You have to
Yeah.
appear a certain way, you have to, like, speak a certain way. And it's almost as if that's not the case in these online communities, when it very much is. You are required to behave a certain way, and you are required. So it's really the same thing, right? You still, like when you go to the lady across the street who's making tea and baking buns, you have to call her auntie. Right? You have to you can't just say, hey, Sasha, I'm here for my
what
tea
up,
and yeah, what exactly? You can't say that. So there, and you have to and when you go visit people, you have to dress a certain way and you have to behave a certain, so there are requirements when you're in a community. There's this sense that when you're in this other community, you're free from all of that, but it's not true. Community quotes, right? You still have to behave a certain way and act a certain, you still have to go according to the code. Yeah. So it's interesting. It really has.
Could I ask you something slightly different, but I don't want to lose the idea, because I think it's something that's particularly difficult for a lot of parents, which is the parent's experience of desistance. As in the child is desisting, and I have had so many, and it's lovely that you have too, Sasha, so many communications about parents who are desisting and how they're finding it or how they have found it, and it feels like it's very difficult on the parents. They can feel very emotional. They can feel exhausted, tense, tired, frightened. Landmines are everywhere. And also, is it desistance? I don't know if it's desistance. That can continue for a long time. There's an awful lot of 2 steps forward, 1 step backwards. So how was your experience, as opposed to your kids' experience of desistance, your experience of your kids' desistance?
I can tell you that, during the whole time when she was, sort of fully entrenched, I always felt myself saying, I just want her to be out of this, I will be so happy and I will just be so relieved. And I swear I'll throw a party, I'll be so happy. I'm going to send fireworks. And when it was over, I was so angry with her. I was so angry with her. And I was like, why would you do this to yourself? And why would you do this to me?
And to us, our family.
Why would you do this? Why would you sabotage yourself so badly? And in that question already was the answer, was that she needed me to change somehow. She needed me to change. She needed the relationship to change. She needed me almost to lower my expectations of her. In a way. Whoa. She needed me to let her be herself and not the better version of me. Not the better version who has had all the obstacles removed from. So I come from an immigrant family, and there were many obstacles in front of me in sort of getting to where I am in life. And in my mind, it was okay, we've done that already. We're not going to do that again. I'm going to remove all those obstacles, so I'm going to be the mom who just opens the world for you and opens the world for you and sort of makes it easy for you to access things and to have things and to, but in so doing that, I think that there were a lot of things that I missed, that put a huge burden on her, a huge set of expectations on her that she did not know how to get the heck out of.
Can I come in? Because I think you've hit upon a really, really common challenge for parents, that we have a natural and noble desire to want our children to have a better life than we had, and to have learned from the things that are hard-won, lessons that we can impart easily. So it's a gorgeous desire. I had the very same for my kids, and I'm learning the very same lesson. And I'd say all the world over we are, which is we think, well, I had it hard. Now I'm giving it, you're having it easier than me. And therefore you can kind of have all the things that I kind of should have had. Do you follow me? Because I have, but it's no, they're doing their own thing. They don't necessarily want to.
For you already. What are you doing?
Now, you go and live my life, the one I would have had and could have had I not had all those obstacles. Go. And they're like, no, I'm turning left here and I'm going to have my own life. And it's I think it faces parents, especially parents of teenagers and young adults, and parents have to learn they go their own way, and it's not necessarily what we think.
The other thing I think
way.
parents have to learn, and this, this I think leads into sort of like a little bit of the psychodynamic theory and the relational sort of piece of it, and is that, the mother has to change somehow.
Wow.
I have to change. It's not just that the child is developing. It's that something about mom has to change. And mom, when I say mom, I mean the primary caregiver, the person who is the main sort of face-to-face, skin-to-skin person as they're growing up. So in my sense, what had to change about me was that the expectation that because I've removed all these obstacles, she's just going to just go out and, just
take on the world.
Kick it out of the park all the time. With other moms, it's other things. Other moms of the sisters have had to also, and this is part of what I try to tell these parents is, they say, well, why can't I just send her these videos of the desister, of the detransitioners, and why can't I just have her listen to podcasts and do all of this? And it's hard for me because I want to say, because that's what you've already been doing all her life. Yeah. You've been giving her information and you've been giving her podcasts. Like you've been doing all of that. And if that was what's going to help this child to desist, she already would have. Honestly, she's asking for something else. And you can't skip to that part. You can't skip the part where you have to change.
So you're saying ROGD is a communication. It's almost a request.
This is what I'm saying. It's not just a request, it's a demand.
It's a demand. It's a demand for something from the mom.
From something from the...
What about the fathers? Like, in fairness, I hear what you're saying about the primary caregiver, but the there's an awful lot of mothers in this field. I'd say, Sasha, you find the same on your Subscribestar as I find on the Substack. And the prominence of the mothers, I remember we did a count at the GDSM, the family meetings and stuff. It was 95% mothers. I know they're the primary carers, but there might be a similar lesson to be learned about the fathers. I don't know what that is, but there could be a corresponding one.
So, in my, I think yes, the fathers do come in, but I also think the entire family comes in. It's the entire family system that comes into it, and the fathers being an important part of that family system. So, for example, you both have worked with kids whose parents are in a contentious divorce, where one parent is quote unquote affirming and the other parent, usually the mom, is flipping out going, this is awful. So part of what that kid is demanding is for the parents to get on the same page. That's what needs to change in that family.
Yikes.
So so if we can get the parents on the same page somehow, then it's more, you have more of the possibility that this child, you have more of the conditions under which this child will desist.
Yeah.
So that's what you're doing. You're tweaking the family system. You're not just sort of like saying to the mom, well, this is what you need to do. And you're not, like you guys know, the kid comes in, how often do you actually talk about gender? When you're doing real therapy? Rarely ever. It starts about gender and it 20 minutes into the session, I'm so mad at my mom. She did that thing again. I'm so pissed off at my brother or why does my brother get this and I don't? Why does he get to goof up and I don't get to goof up? I don't get to fail.
Yes.
You get
That,
so
that
much of
exact
that.
story is in our book. That's
Yeah.
exactly a story in our book, that the brother
Yeah.
gets off easy for whatever reason, and so why is that so unfair? And it's a subconscious thing that, like, well, let me inch towards that. The boyhood is the better thing in this case.
Right. There's that, but there's also that FU to the mom,
Yeah.
you know? You wanted you or to the parent. Like when I say mother, I mean like in the sort of the M with the apostrophe other after, like the other,
The primary
that
caregiver.
person.
Yeah.
Yeah, the mother.
Yeah.
I don't mean the mother per se. I mean just
Yeah.
like sometimes I mean the mother, sometimes I mean the parent, the parental unit, the spousal unit, and sometimes I mean the entire family, the community as the mother. The mother is the environment. I think it was Winnicott who said the environment mother. The mother is the environment in which the child emerges.
The whole
the
context, child. Basically, all of
right, the whole
feeding
context,
into
yeah.
the child. Well, feeding,
and
that's
because
an
of the
interesting
culture
word.
and because of the culture we live in, the mother, the female parent, seems to be the one who is sort of leading all of this, seems to be the main element in this environment.
Yeah.
She, directs the environment. She sort of tweaks the environment. Mothers are very burdened, but they're also very powerful, I think.
Yeah.
We hope you're enjoying this episode of our podcast. We work very hard to maintain high quality content for the show.
To take an even deeper dive and support the show, join our listener community for access to exclusive content, practical tools, and resources supporting gender and identity exploration. We're so grateful to our sponsor, GenSpect, an international organization which offers an alternative to WPATH, providing a range of education, resources, and supports to anyone impacted by gender distress. GenSpect unites many different organizations globally and gives voice to thousands of previously untold stories. For more info, visit genspect.org. And thank you to our sponsor, GETA. GETA is an association of therapists who believe that individuals experiencing gender-related concerns ought to be treated using a whole person approach.
We connect like-minded clinicians, provide educational resources and training, and help people with gender dysphoria find the right help.
Visit GETA at genderexploratory.com. And now back to the conversation. Maybe this is a good place to kind of lead into the psychodynamic approach, because you touched on this in our last conversation, and you also kind of alluded to the fact that, what psychodynamic and really good therapists do in sessions should be accessible to parents too, just to understand these dynamics and what this means, right? Like, what is the meaning of this, which I think is really missing from the gender affirming model. There's no sense of meaning about these symptoms. And so can you talk a little bit about, what does psychodynamic lens help us understand about this?
So when I say psychodynamic, psychoanalytic, I mean that I come from a perspective that understands that there's more to it than just behavior, so that there's something unconscious going on.
Yeah.
And that the unconscious, you can think of it as, a program that's running offline, but it is running. And it's talking to other offline programs that are running. And it does have an impact. It has an immediate impact on the individual and on the individual's surroundings. So when I say psychodynamic, psychoanalytic, that's what I mean. I mean that there is something going on underneath it all, and that something is very complicated and very complex, and it's affected by history, it's affected by culture, it's affected by the family system. It holds on to trauma when trauma isn't sort of in the forefront of your mind. It's there in the unconscious. It's sort of like it's calling the shots in many ways. And if we're just looking at the behavioral piece of things, which is really important, by the way, especially in dealing with teens. So, DBT is a fabulous thing, but I also feel like we have to look at what's underneath, and we have to look at what's underneath, not just for the child, but also for the entire family. So that's what I mean when I say psychodynamic. Particularly, my interest is in, sort of comes from the British object relations tradition, that sees a relational development, that the child develops in a relational context, and how those relationships happen has a very profound impact on who this child will become and how this life will unfold. So what we say is that the child starts out completely dependent on the mother, on the primary caregiver for everything, and there's a symbiosis there, that the mother, the child sort of, if the mother is not there, the child cannot survive. And there's something incredibly vulnerable about that position. But because of the vulnerability of that position, there's also a sense of omnipotence there, that, the child doesn't know that the mother is a separate being, doesn't know that the mother is, can be willing to give the breast and can pull the breast away. But the child cannot survive without this sense of omnipotence. Psychically cannot survive the possibility that the mother will pull away. So it's very symbiotic. That's where you have a lot of magical thinking. You have a lot of the next position that the child goes into comes with the recognition that the mother is a separate person and has a separate mind. So there's a grieving that happens here, and there's a sort of loss. And so the world then, because the child needs to organize the world and have it be sort of intelligible, the world goes into like a very binary kind of interpretation for them. Things are good or bad. Things are black or white. Mm-hmm. So I'm explaining all of this because I then want to go back and talk about how gender ideation works in this system and how I understand it. Okay. So once that's called, if there's an unfortunate name given to it, it's called the paranoid schizoid position.
I know. Terrible.
Yeah, I know, it's terrible, right?
And you have to say it, and then everybody goes, oh.
Because yeah. No, and the one before that I just described, the state of complete symbiosis, is even worse. It's called the autistic contiguous position.
Branding is really a problem in this psychoanalytic space here, I think.
It's a lot of language, it's a lot of language, but you have to, I always tell, like, when I talk to students and when I talk to, people that I work with, I say, you have to hear it metaphorically. You can't hear it literally.
Yeah.
You have to hear all of this metaphorically.
Which is how we always should have read these gender problems. We all
absolutely 100%. So beyond the paranoid schizoid, once the development advances more, say beyond 7 years, beyond the age of 7 years. So the paranoid schizoid is pretty dominant from about 9 months old to about 5 to 7 years old. So the preschool, early school years. Incidentally, isn't this when a lot of these gender dysphoric kids say, I knew when I was 7 years old that this was happening? Mm-hmm. Interesting, right? So beyond that, after 7, they start to develop some other sense that like that person has another mind, and that person has feelings, and I can affect those feelings, and that person affects my feelings. And I'm like, we'll never be the same person again. Like, I will never merge with another person again. And that's so depressing. Yeah. The fact that, like, I don't have control over another person's mind, that I can't make Susie be my friend if she doesn't want to be. Mm. That I can't, that I'm not good at everything. I'm good at some things.
It's a terrible confrontation with reality. It's awful.
That my dad is never going to come back and live with us, So that requires a lot of maturity. And a lot of sort of understanding, and it requires a lot of grieving. A lot of grieving and a lot of letting go. But here's the thing, once you get past that, once you're able to grieve, and once you go into, let's say, and this goes on for a long time until like the mid-20s to the 30s. Notice how they say your brain isn't fully mature until you're 25 years old. It's because you haven't gone through the full grieving process, I believe. The full grieving of life is limited, people are not going to like me, the people I love are going to leave me. I can't make someone love me. I can't make someone believe that I'm something I'm not. Like truth is reality is reality. This is what happens over the course of like between let's say 14 and 25.
Okay.
20, 30 even. So, but once we get there, we get into this other position. It's called the transcendent position. And in the transcendent position, it's almost like being, like you just don't care anymore. It's like you just like, yeah, some people aren't going to like me. That's great. They're like the fisherman who has to mend his net, even if there's like someone who's going crazy on the shore. Like, if I don't mend my net, my kids aren't going to eat.
I agree with you, but I'd say that rather than 25, 30 we get it, I'd say it's about 60, 65 is when we move to that.
Well, I'm feeling a lot of that right now as I edge very quickly towards 60 myself. Is like, my hair is out of place. Okay, you know what? I'm going to show up anyway. This person's judging me. Big deal. Whatever.
A liberation comes in late middle age.
It's very liberating. And this is why we want to hold on to these kids until they can be at this age where they can experience this, like, I just don't have a single F to give anymore. It's like IDGAF.
Yeah. I mean, I have to say, I want to just kind of ask something about this, because my graduate program didn't include any information about object relations theory, though I know a little bit about it since leaving, because I've done a lot of trying to learn on my own. But I have to kind of raise this thing that comes up for me. This feels very much like some theory that we can apply after the fact to people. And then if it's not working, then perhaps we can say, well, something went wrong in the development, right? So like there's a part of me that is a little bit, I guess, of a skeptic about a lot of things. And this feels like such an airtight, very reasonable way to understand. And there are definitely like obvious nuggets of truth in what you're saying. But part of me feels like, well, is that necessarily true for everyone? There are lots of people that never get there. Yeah. And does that mean that if only this bad thing hadn't happened to them, they would have gotten there? Or if only some kind of thwarting in their development hadn't happened, then they would have gotten there? Like, this seems like a very ideal version of what human development looks like.
Well, I think that the whole theory has implicit in it that these things can get thwarted at any point in the life course. And I'm looking at it as a clinician. Mm-hmm. So as a clinician, if I understand, the other thing about, I just want to say this before going back. The other thing is that this is not understood as a linear development.
Okay.
All of these positions, this is when they come online. They come online as we get older. But you can always go back into the other position. Like there are situations in which you might be required to go into a paranoid schizoid state because you have to manage something. You have to like see things as black or white in order to be able to organize what your response is going to be. Yeah. Similarly, like when you fall in love and when you sort of like release all of your inhibitions to someone, that's definitely going into a more primal, autistic, contiguous kind of place. So that's necessary. But as a clinician, I'm looking at the client, the patient, who is saying, if you don't affirm my gender, you're a bad person, and that's very paranoid schizoid.
Yeah.
That's very, you versus me, that's black versus white. And so my work is, I can't confront that. I can't say, well, no, that's not true. I am a good person. That's completely useless in that moment. What's useful is to just stay with that and to just grow into that in a way. It's sort of like, I'm going to become more human to this client as we go along. Yeah. And they're going to see me as, someone who has strong opinions about gender maybe, but someone also who has a lot of like warmth and empathy and like really cares about them. Yeah. And so then they're going to get to a point of where they have to integrate this therapist who is opinionated and very caring. That's already an integration into a more depressive position. In the room, in the therapy, in the context of the therapy.
So when you say depressive here, again, just for those who don't have the language, what does depressive mean in this context?
Depressive means that you move out of a black and white thinking position where, so for example, you can say, my mom isn't affirming me, but she's a really great mom.
Yeah.
Nice.
Yeah. So you have to sort of grieve the fact that your mother is never going to join you on that side of the trans, world. But she's also a great mom and she really loves you.
And to go back to the desistance of the parents of desisters in this context, do you think, in your experience, is the kid who's desisted, is there an appreciation for the lack of affirmation that the parents are desperate to hear that there will be? But let's say go for the truth rather than what we know everybody wants them to say.
The appreciation does not come directly. Yeah. If there is, it's definitely like a,
backhanded.
Let's go get a pedicure.
Right.
Yeah. Let's let's go get boba. It's not at all like, Mom, thank you so much for having held the space for me. None of that.
And I'm sorry to the parents that I asked that, but I had to say it because we do have to know, because I think a lot of parents are hoping for that, and that's not what's coming down the road. But other things are coming, and it's a liberation. You know what I mean?
And
it is a liberation. It's a liberation for the parents too.
Yeah, and I want to say, as someone who's worked with a lot of dysphoric patients, they often in therapy can acknowledge, when I was young, everybody but my parents was pushing me to transition, and I understand why they didn't want me to. Yeah. But they would never say that to their parents. But I've definitely heard a pretty sober and conscious recognition of the parents' choices, but there is also pain from the conflict, and that doesn't go away.
Very much so. Yeah, that doesn't go away. But it's also not something your child is going to help you with necessarily. That's your own work.
Yeah.
Your child isn't going to be the one to say, oh, Mom, I'm so sorry I hurt you. Your child at best is going to go off and live their life and be happy.
You're not going to get well
and
played,
if you can
Mom.
be happy with that, none of that. I think, honestly, do we really? I didn't really appreciate my own mom until I became a mom, and I kind of realized, what a pain in the ass I must have been.
Tell me, we met at a conference recently, and you said you had a very interesting experience with a gender affirmative clinician.
Yes, a very important gender affirming clinician I had an exchange with. So, we were talking about the Dutch protocol, and there was a panel on assessment, and she was having a side conversation with another clinician that I overheard, where she was kind of like pushing, but you don't know, this really helps people. We've helped so many kids and they're so happy now. And I said, it's not like that in America, and I can tell you as a parent that it's not like that. And initially she dismissed me and she said, well, I'm a parent too, blah, blah, blah. And I said, that's not what I'm saying though. So later on, interestingly enough, she came up to me and during a side conversation asked me, she said, so you're a parent, are you? And I said, I am indeed. And she said, so what were you trying to say? And I said, I think what I'm trying to say is that we're talking about two very different things. I think that when you guys think about the Dutch protocol and what you're all doing, I think the Dutch protocol has come up in a particular cultural context that's very different from the context that we have in the United States. And so when you take this thing that you've developed and you put it into a different context, it doesn't work. It's not working. Not that I know that there are lots of problems in the Netherlands, whether it's working or not, but I feel like, I had her ear and I was going to talk. So then, I don't know if she was buying it or what, but later on, we kept talking and I said, so for example, there's this great book written by Amy Shallett, who wrote a book comparing the sexual development of Dutch kids versus the sexual development of American kids, and how Dutch parents are so much more permissive than American parents. Like Dutch parents allow the kids to have sleepovers with their boyfriends and girlfriends in their own home, and in America this would never happen. Parents would be like, not under my roof, get your own place, do whatever you want, if you can pay your own way. And the funny thing is, she told me that, it turns out that the author of that book is one of her best friends.
Really?
Turns out to be, one of her best friends. And so I think that, for some reason, something clicked for her that I had actually read her best friend's book.
Mm. Interesting.
Meaning you're a reasonable, sane person who has good taste in books.
Yeah.
I guess, and so, so her eyes kind of immediately lit up and she was like, that's really interesting. I haven't thought of it that way. And then later on she came to me and she said, I think I'm going to have my friend do a study on, American trans kids versus Dutch trans kids and see, what we can learn from that. And I thought that was really interesting because to me that felt like a softening.
Yeah.
In a way.
Yeah.
It felt a little bit like, so that's where I get a little hopeful, and I feel like maybe, I mean, certainly not in the activist realms, right? But in the medical sort of professional realm, maybe we're starting to talk to each other.
Yeah.
The two sides, maybe we're sort of maybe we're making some personal connections that, that they sort of see us as not being unreasonable and not being hysterical and, not being transphobic, but rather really protecting our own kids against something that doesn't work.
And maybe, I agree, maybe the Pit book, which is out, so people can order their copies now. And you're in the Pit book, aren't you? Do you want to say just a tiny bit about your article that went viral and is in the Pit book? I wrote the foreword for it. But maybe that Pit book will make some inroads into, these are really decent parents. These are not crazies. You know what I mean?
And many of us are clinicians. Many of us are physicians and psychologists and, and most of us are really until this point, we're very progressive thinking. None of us are, I don't know, we're all quite reasonable and we all love our kids.
Tell us about your article.
So the Pit book, Well, I mean, that's the article. It was the essay to my daughter's therapist, You Were Wrong, and I wrote it exactly 2 years ago, I think, that I submitted that essay. And I didn't know this, but apparently it was the first piece that went viral, and really got Pitt on the map. And I'm kind of blown away by that, because really I was just telling my story. But yeah, it is in the book. And in that story, it talks about my choice of taking my daughter out of the country. What's become, I think it's erroneous to sort of call it the nuclear option, because honestly, at that point, if I didn't feel like she could sort of do what she did when we went abroad, it wouldn't have worked.
I want to touch on this
Very good
because
point.
this is so important.
Yeah.
And I think I even mentioned this in our last conversation. You had thrown out the idea of traveling to her at one point in time, and she said no. And then you waited for a long time, and you asked her again, and she was thrilled. So I just want people to understand, because sometimes our position about travel is misconstrued as like forcing a child to leave their... No, we're talking about giving a child the opportunity to do something interesting that he or she really wants to do, that could be fulfilling and meaningful and help them expand their sense of self and their character. So that's such a good point. So thank you for raising that.
The other thing is, I think that parents have got, and I mean, I can't blame them, they want to be done with this already. They have this like wish or hope that like there's this one thing they can do that's going to bring their child to desist. Like if I take them, and I'm sure I was in that kind of a mindset too, like if I just do this, maybe it'll work. And it's like the same thing as like, maybe if I just sit her down and do an intervention, maybe she won't, or if I send her articles about this, maybe she won't go through with medicalization. Or maybe if I, and it's sort of, to me, that's like missing the real task. The real task isn't finding that one thing. The real task is changing. Is changing the relationship.
How?
Somehow.
I mean, if you had a parent that you were working with and they were trying to understand what's going on, what advice can you give parents about how do you know what to change about your relationship? How do you know what you're supposed to be doing differently?
It's already what the kid is complaining about. Like my mom insists, my mom checks my grades every day. Stop checking her grades. Even something like, my mom reads to me. My mom still reads to me every night. Stop doing it. Like have you asked your mom not to? Oh, that's a good idea. So there's something there. There's like some kind of orthodoxy in the home that the child is like ramming against, is saying, I don't know how to make you stop doing this, but I'm going to create this big thing. And finally, hopefully you're going to change. Something is going to change about you, because I can't, this is not good.
And for some kids I've worked with, I've noticed their ability to figure out themselves what it is they're saying no to. It's all, they've channeled it into gender, and they're not as clear as where you are with maybe with your kid. It's a much more, they're acting as if it's all fine, and then it's only quite deep into the relationship I realise, oh no, they're actually very angry about certain things that you wouldn't have noticed at the beginning, if you follow me, that they come across kind of
things like, I mean, we all know the mom who, when the kid goes to the mom with a problem, the mom somehow has an even bigger problem. The fact that the kid has a problem creates an even bigger problem for the mom. And so the mom now is hysterical, and the mom is like, falling apart and can't have like a calm response to this child, and so this is exactly the time when, you mom have to change the way you respond to crises. That you're like, when your child brings you something and actually like does you the favor of telling you, I don't like this about our relationship. you know, and if you can't hear that, you know, then I don't know. I don't know what else to do.
And as well as that, the
You know?
pressure which you and I have experienced, Maggie, which is well, you have it easy compared to my childhood. So any unhappiness you're feeling is frankly, I can one-up it from when I was your age.
That's right.
And that really quenches the kid's kind of existence. And it's a horrible thing to impose on a kid's shoulders. Like, your unhappiness is only lightweight. I was facing something much worse. Get over it. If that's your general tone, which guilty, you know what I mean? So I'm not saying it in a judgmental way, but I've noticed it. I definitely noticed it with teenagers, and it's a pressure on them. They should be happy.
Yeah. The other thing, speaking of pressure, is the other thing I want to really tell parents is, like, find a way to hold this lightly. You know, like, find a way to, like, find humor in it. Like, don't turn it into a funeral every single day.
Totally. This is so important.
You know, just don't turn it into like a, you know, like one kid said to me, you know, I want this to be a fun thing. I don't want it to be like, you know, it's like, I want it to be fun that I dress this way.
And the parent is like,
I don't want it to be like this. You know, every time my mom sees me wearing, you know, a hoodie, she like falls apart. And it's like, and I'm thinking about, you know, the time when my daughter, long after her desistance, decided to color her hair purple, and I went into a panic state, going like, here we go again. Yeah. When in fact that wasn't it at all.
Yeah, for sure.
You know? It's like, but that's trauma, you know.
I wanted to share a story. I have a really good friend who, her daughter at the time was 12, and she never really went down the rabbit hole, maybe partially because of how my friend very cleverly responded. But, you know, one day her daughter, no gender dysphoria as a kid, said, Mom, I don't think I'm a girl. And so she sat her down, they had a conversation. She said, do you think you're a boy? And she said, maybe. And she said, do you want a penis? And she said, no. And she said, do you want me to use different pronouns? And she said, I don't know. And my friend said, well, okay, we'll give it a couple days and see how it goes. So she turned it into kind of like this big charade. And she said, hey, bro, are you ready for basketball today? And her daughter was like, and she said, hey, dude, your dinner's ready. Like, she turned the whole thing into kind of a fun, playful thing. And she wasn't being, you know, she wasn't taking it too seriously. She just said, okay, you're 12. You know, you want me to call you a boy? Okay. You know, you and your brother come to dinner. Like, did you, you know, stand to pee? Like, she kind of turned the whole thing into something light. And the daughter they would kind of laugh about it together. And then eventually her daughter said, it's fine, Mommy. It's not a big deal. I don't think I'm a boy. And it like lasted a week, something like that.
Yeah. So two comments on that. Your friend knew her kid
very well.
And she knew she could do that with her kid. She knew, she kind of had a sense of like what her kid was going to be able to tolerate. Another 12-year-old might have gone completely, you know, bat crap over, you know. So your friend knew her kid. That's the one thing. I forgot.
Well, I can think of something while you're thinking of the other thing, because it reminds me of, you know, obviously I'm gender, and my husband Henry is often too. And just on a crazy whim, my feminine daughter, who was always feminine, having been a very masculine kid, I kind of encouraged a certain femininity in her when she was 2 or 3, or else it was natural, I'll never know, but certainly that is the way it's gone. And when she was 12, it was during COVID years, and she hopped up, we were all watching telly, she hopped up suddenly and she kind of put her hair under as if she looked gorgeous in a cap. And she said, I think I'll be a boy. And me and Henry just looked at each other like like this kind of freakish horror film look. Just we shot at each other across the room. And she hopped around like I'm a boy. Just, I suppose it was an hour or whatever. And we were like, yeah, no, cut that, not a chance. We were funny about it, but we said, yeah, hilarious, not a chance, get over that. Do you know what I mean? Yeah. Again,
so I thought of the,
again, knowing the kid. It's like, you're not going to play that game. Yeah, hilarious, sit down, let's watch the film. Now, I know my kid, and I knew what I was doing, and I knew where it was going. But I remember that look, me and Henry just looked at each other like, what that is this how it begins was like just emanating in the room. Sorry, tell us your thing, Maggie. Yeah.
Yeah. My second thing is that, I'm going to venture to guess that your friend's daughter probably doesn't have other serious mental health
Correct.
comorbidities.
She's very well. She's
Right.
a wonderful, I mean, she's a sensitive kid, but she's got a lot of friends. She's doing awesome in school. And their relationship is like unbelievably tight. So, yeah, totally.
So those are the two
100%.
things. So which then brings me to say that when we're treating a kid who has gender dysphoria, who's presenting with this, the two things that we're doing is we're saying to the parent, know your kid and connect with your kid. And the other thing we're saying is, let's see what the comorbidities are and let's treat those as well. So that we can get to a point where the mom can say, all right, bro, and hold it lightly, you can't always sort of do that. It's not in every situation that's going to, and frankly, a lot of these kids do have lots of comorbidities.
Yeah, and what often happens, which is so different from my friend's story, is that these kids are dealing with something that feels very dark and heavy, and they're really in a difficult place. And so when they come tearfully, crying, begging their parents to call them a boy, it feels so much more monumental and serious, rather than my friend's daughter, who was clearly like reading something on TikTok and she thought she'd kind of play around with it in a light way. So I think, that's why we say parents have to know their kid, and we do believe that in many cases parents know their kid best. But I want to ask you a question as we kind of round out. I have noticed that the parental anxiety is so high, and it's contextually completely understandable because their kids are going through this really dark place. They're being undermined by doctors and therapists. All of this has come out of the blue. They're really scared about medicalization. So parental anxiety is high. And when parental anxiety is high, it's also very hard to connect in a genuine way with your child, which is precisely like what we're trying to help parents do. So do you have any thoughts or advice for parents who are simultaneously anxious? They're trying to bond with their child. They're trying to help the child separate. And in some ways, all of these things feel like they don't go together well. So what do you have to say about that?
So, self-care is so important. And this is something that, parents will often ask me, is there anything I can do? And I'll tell them, go take a walk is what you can do. Go have coffee with a friend is what you can do. Go play, some tennis. Go do things that feel good to you, because this is the long haul. This is not going to go away fast, and you're going to have to take care of yourself. That's the one thing I say. The other thing, if at all possible, very often I feel like the primary caregiver does need to be in therapy.
Yeah, I agree.
And I know that that's a very difficult thing because, even therapy for the kid is probably really expensive. But I really feel like the mom, in most cases, I'll have 3 or 4 sessions with a kid, and at the end of the 4th session, I'm like, mom needs therapy. This mom really needs to get in there and do her, she needs support. She needs someone that she can, sort of empty out to, because otherwise it's all going to get dumped into the relationship with the child. When this was going on with my kid, I was in therapy twice a week, and for good or for bad, I needed to do that, and I needed to do it for my kid. I needed to have someone else support me. So if that's what you need to do, then that's what you should do. So that's really it. I think self-care is really important. Self-care, physical self-care, mental self-care, relational self-care, all of those things. If you're not well, you can't help your child get well.
It's so fundamental, but I often say, this gender thing comes into the family and completely throws off everybody's sense of what to do in a crisis, because it's it doesn't feel normal.
Yeah.
It doesn't feel like you can rely on kind of the other things that you would otherwise do if there was an issue. And so it's so important to just talk about these foundations. I mean, we talk about this in the book. There's so much about parental self-care and parents not losing themselves in the process, because that's not going to help anybody.
It's so hard. It's so hard to care for yourself when your child is in a crisis like this. It is so, it's almost like, telling the mom, nap when your kid naps. It's like, what do you mean nap? I can't nap. So that's really important. I think self-care, and in many cases, rather than, if you can't find a therapist for your child, if you can't, there aren't enough non-affirming therapists to go around, unfortunately, but get a therapist for yourself.
Go to GetA and find a therapist who gets
there's lots of places
thing.
now. I don't think it's quite the desert it used to be. There's GetA, there's CTA, critical therapy antidote, there's therapists, there's Beyond Trans, we have beyondtrans.org. There's a list of over 80 therapists on that. So there are therapists out there nowadays. But also in terms of finding a therapist, I find that, there's lots you can know about a therapist just by knowing about when they were trained and how they were trained. If you find a therapist that's already in her 50s and 60s, that her training was before this sort of gender critical theory explosion. So you might find better rapport with someone like that. Especially who can be more thoughtful and has more and
experience.
Especially if they're independent as opposed to working in a clinic or a larger centre.
Right. Yeah. Exactly. I remember exactly. So there are ways.
I remember just to add. I know we're finishing up. I remember just to add. I think it can happen in all walks of life. I remember my kids were being faced with something really quite difficult once, and I had a therapist. I got myself a therapist because I knew I would be insane around my kids if I didn't have an opportunity to just process this. Well, they were able to handle it as such, but I definitely needed it because I was just going to go mad. I think we really do feel the pain of our children very, very deeply. And it's very generous to realise I'm holding it too tight. My emotions are too high. I need somewhere to process that. Rather than presuming straight away it's the kid who needs the therapy. I just don't think that's natural.
100%. Yeah.
That's great. Well, Maggie, we are so glad that you are back on. I know that, of course, this is a pseudonym. As I remember from our last episode, a lot of people contacted us wanting to get in touch with you. So if people listen to this and would like to either work with you or just kind of get in touch, is it okay if we put you in contact with them kind of in your other email and your other name?
Yeah, you can just, I'm very responsive when people reach out to me. This is something that the people who work with me know. So if they reach out to me through you, I will give me their info and I will get in touch with them.
So what we're going to do, Maggie, is we're going to keep you for a few more moments. We're going to have our dinner party conversations where we ask you to tell us how do we talk about gender IRL with people in life. But at this point, we will say goodbye to our general audience. And then if anyone wants to hear our dinner party conversation, they can join us in our listener community. So thank you.
Thanks, Maggie.
Thank you.
Thanks for joining us this week on Gender, A Wider Lens. Listener support means a lot to us. If you enjoy the show, please like and subscribe on iTunes and leave a review.
For more information, visit widerlenspod.com. There you'll learn about joining our listener community, how to contribute to our show, and where to find us on social media.
Our discussions are for educational purposes and are not intended as a substitute for mental health services.